Overactive bladder is a condition that causes a sudden, frequent urge to urinate, which disrupts daily life. Many people suffer in silence, thinking it's just a part of aging. In today's Ask the Experts, we hear from a specialist who explains the symptoms, causes, and treatment options that can help people who suffer take control back.
Okay, overactive bladder, it can affect all ages. It typically gets a little more common as you get older. Now, versus stress incontinence, which is a structural problem, overactive bladder is more of a functional problem. The bladder either is more sensitive to the volume of urine in the bladder or the muscle itself actually contracts. There's several ways that you can get that. One, the muscle actually becomes hyperactive, which is where the overactive come from. Or, which is we're finding out being a lot more common now, is that there's a communication error between the bladder and the brain. And so those signals kind of get abnormal that the bladder sends the brain, and so they get overactive, so the brain thinks it needs to go to the bathroom, and so that's where you have the urgency come from that characterizes overactive bladder. And so some of the newer therapies actually target that communication between the bladder and the brain. So yeah, there's two major categories of medication for overactive bladder. There's one which is called the older medication, which is called anticholinergics, which blocks some of the nerve transmissions into the bladder, or the transmitters into the bladder. They work for some people. They do have some side effects of dry mouth, constipation. You have to be careful in older people because they sometimes can cause memory problems. Or they can cause what's called orthostatic hypertension, where they stand up, their blood pressure gets low, and then they fall, which we don't want older patients doing. There's a newer one, which is called a beta-3, which actually doesn't block the transmission of the bladder, helps the bladder relax more. So it typically has a little bit less side effects than the other one. Both of them work really well with it. And then there's an injectable called Botox, where you can inject that into the bladder.
This segment, Ask the Experts, on Today at 11 is sponsored by Urogynecology Associates in Flowood.